No, now it
Okay.
says 7:57 still.
All right, I'll stop. All right. Well, I will be administering Lasix and levoflexin. The Lasix will be through just through the regular injection IV port, while my levoflexin will be through the IV piggyback. I'm gonna get my medication and make sure I cross-check it against the MAR twice. Check the drug compatibility with my normal saline, my IV primary fluid. I'm gonna check against the MAR. The patient's record to make sure that there is no allergic reaction or their compatibility also with the medication. I'm gonna grab a medication. I'm gonna wash my hand. Go to the patient's room, introduce myself, get their name and date of birth, ask for any allergies, just to make sure that we have that cross checked, and provide privacy. Wash my hands, apply gloves, and now it's time to start the medication. First, I'll be starting with my Lasix. And with my Lasix, it's requiring 2 milligram, which is going to be, and this is like 10 milligrams per meal, so it's gonna be pushing out 2 milliliters. Always make sure you clean it with your alcohol swab. And because I'm gonna pull out 2 milliliters of air.
So three medical and three. So if you guys want to do that, we have the packet for your medical. Yeah, because I want to keep doing that. I got the packet for this machine, so it's hard and stuff. So it's like you're doing. It is kind of expensive. But to do the 24-day challenge for the two of us.
Okay.
No, we both do pretty good at it. Like, we really want to do it.
I have made sure I've told the patient just things they might feel, any side effects that they might have. And with Lasix, I'm just going to make sure I monitor their vital signs and their potassium serum level frequently, just because it has a tendency to cause hypertension and also hypokalemia. I'm going to clean the port. I'm going to make sure I have my flush. I'm gonna have to clean the port again. Kink it. Just gonna insert half of my flush.
First, I'm going to flush 2 milliliters of medical storage using an alcohol.
The first one, this is the second one, we're going to give them a clinical one, the third one, you know, and so we rented that, this is so they can extend. And all 60 of them go the same day. This is, the process that we're following. You know, you pay for mileage or whatever, and I paid like $4 for mileage. He's like, did you even drive this?
Continue the flush. And while I'm doing that, I'm also checking the patient's facial reactions just to make sure they're not going through any pain. And before I inserted my medication, I checked the IV site to make sure there is no, just for the patency of it, just to make sure there is no infiltration, phlebitis, or just anything that is unusual. And that was before I inserted the medication. And now it's time for me to administer my piggyback. my piggyback, like I said, I'll be doing the liver flexing and now the drip rate factor. This is 50 milligram, 500 milligrams should be administered over 60 minutes, and my drip factor for the will be 21 drip per minute. So first, I'm going to put down my primary tubing because that needs to be lower than the piggyback.
I gave him beer. I gave him beer and then I gave him some money to get pizza. But we didn't order beer pizza.
I'm gonna make sure this is locked before I spike my piggyback.
They figured out that they made a mistake, that they gave us the wrong apartment. They gave us an apartment that wasn't really empty. And this was literally like the Tuesday when we were supposed to, it was Tuesday when they figured this out and we were moving on Friday. And,
Now I'm going to prime it.
and, so I tried to
I don't
get
like the
my
bar
truck
section
because they
because
finally did find us
I
a
don't
new
see
apartment.
where there's any place
Problem
where
was
Okay.
it was a
they
furnished apartment.
can enter
Out.
It's been
But
primed.
the company where they
like
did the
interventions
furniture
prior to the
furniture
demonstration
well, I have my truck told me.
what interventions would
Gonna
you
make sure I clean the port also that is connected to the primary fluid and also to the IV site.
And so
Just gonna, this is clean. Clean the port.
you gotta just check it.
So I called Bolus.
Well, and then I checked my
Yeah, I do too. But you go through each order position. Well, that's.
Okay. And with that, I'm gonna using my timer set my drip rate factor. My drip rate should be 21 per minute. I'm just gonna do this over 15 seconds.
I called several companies looking for a truck and found one that was $200 when the U-Haul was only gonna be $50. And even they couldn't guarantee me I had a truck. And they couldn't guarantee me I had a truck.
And also making sure that my number sailing is also going.
I did have the U-Haul.